We gotta get this crowd of politicians to sit down. Barry, you singing?
Let me just
Okay. Let me just introduce Professor Bluestone for a few minutes, and then we'll get into our.
Hey, hello. I've been up all night, so I'm a little tired, but I'm really excited about hearing this. Plus, we were at Ideas Boston today, which was a real exciting thing we had at UMass Boston. We are very excited to see you all here, and we have obviously a wonderful group of folks here. How many of you were here for last week when we had Ambassador Burns and Steve Kins of the New York Times? Pretty great evening. We're in for even a better evening tonight. I've also been asked if I would let you know that there's a petition outside, and during our break or at the end of the hour, this is the one that's around about the whole question of Citizens United and money in politics. And you might just check this on the table during the break and see how you can help on that one. So that tonight is the first of two open classrooms devoted to what may be in many ways, if not the first, at least the second most important issue in this election, that's healthcare. And we're going to be looking today at healthcare, doing it again next week. And of course, tonight we have two wonderful speakers, including my dear two colleagues here at Northeastern, Wendy Parmet and Dr. Dukakis. Welcome. All yours.
Thanks, Barry. Actually, we had a little bit of a missed set of communications. We had hoped and expected that Don Berwick would be with us, and we just kind of messed things up a little bit. He is a wonderful guy, a doctor, one of the great healthcare people, and was the head of the Centers for Medicare and Medicaid on a recess appointment for the president for healthcare, year 2 or more. But he couldn't get confirmed because he had some nice things to say once about the British National Health Service. But he has told us that he will do everything he can to join us at some point. We may in fact ask him to come to our last class in December, which should be fun because by that time we'll know a lot more about the fate of the Affordable Care Act than we do now. So our apologies for the fact that Don is not here, but we hope we're going to have a chance to welcome him and we're going to have a chance to listen to him. It's a great treat. He's as good as anybody there is in this business. So I'm going to begin by introducing this. Politicians do not use PowerPoint, at least my generation. So I apologize for that. You just have to listen to it. And then I will be followed by Wendy Parmet, who is one of our finest law school professors. She and I have served together on the board of something called Health Law Advocates, which is the public interest law firm that represents people who have serious questions about the healthcare system. And there's also the legal arm of Healthcare for All, which is the consumer advocacy group for healthcare in the state, and has played a major role in what has happened here. So you're in for a treat with her. In addition to some comments about the Affordable Care Act itself, she's going to go into a detailed and clear discussion about the Supreme Court decision. What was it? What did it do? What did it say? What are its implications? And there's a lot more there, folks, than just a decision that this law was okay. And she'll talk about that, because the implications of that decision are much more serious and much more profound than simply the fact that by 5-4 they said yes to the Affordable Care Act. And for a lot of us, there are issues in that opinion which are very concerning. But Wendy is going to get into that. Let me ask you a question. What was the first national presidential campaign in the history of this country where health care for all of most Americans was a serious issue?
1912.
1912. Who was running? Who else?
Woodrow Wilson.
And William Howard Taft. It was a 3-candidate race. Roosevelt had retired, was mad at Taft, came back, ran on the so-called Bull Moose ticket, actually finished second. and probably had something to do with Wilson winning. And Wilson himself didn't get more than 43% of the vote. What did TR propose? Any of you know? Wasn't very detailed. Nobody? Well, essentially, he wanted to build on the ideas behind workers' compensation, which began in the Commonwealth of Massachusetts, Mr. Speaker, in 1908, and in effect said that all employers would have to provide insurance for their employees in the case of injury and disability caused in the course of their employment. That was workers' compensation, began here. So the model of a statutory mandate requiring employers to provide insurance in that case, TR basically wanted to expand to employees and their families generally for health care generally. Didn't put out any position papers, it wasn't very detailed, but that's essentially what it would be. An expansion really of the notion of workers' compensation would include health care generally for employees and their families, without regard to where it happened, on the job or off the job, whatever. Now in 1916, we had a gubernatorial race in Massachusetts. And the Republican ticket essentially endorsed the same proposal for Massachusetts. Who was the candidate for lieutenant governor on that ticket? You know this, you don't have to take the file. Nobody? Calvin Coolidge. He and his Republican running mate, they won. But we're proposing, in effect, the TR plan just for Massachusetts in 1916. Now that didn't get through either. But it's interesting that 100 years ago, we had people at the national level, Teddy Roosevelt in particular, and in this state, including Calvin Coolidge. And in those days, the lieutenant governor ran independently of the governor, but they certainly were a Republican ticket, proposing effectively universal health insurance, either for all Americans or all people here in Massachusetts, with employers taking responsibility for that. Not much happened when we got into the 20s and 30s, and then a concept called Blue Cross Blue Shield, Blue Cross originally, Blue Cross, not Blue Shield, developed. What was that? Blue Cross. What was that? A non-profit insurance entity on a state-by-state basis. It provided health insurance to individuals, to their employers, just for hospital care. That was Blue Cross. Blue Shield was added sometime later. And that covered physicians' expenses. And these Blue Cross Blue Shield organizations had a special status under state law. They were non-profits, they were not taxed, but they were expected to take anybody who wanted their insurance, and they priced it at what we call a community rate. What does that mean?
Low.
Same price for everybody. Same price for everybody. But they could not and did not deny people insurance coverage because of pre-existing conditions or any of that kind of thing. They took everybody. And they had this special protected status under state law. And then World War II broke out. And there was a surge of employers, especially in the defense industry, who began, in many cases, purchasing Blue Cross Blue Shield coverage for their employees during World War II. How come? How come? Wages were frozen. How many of us remember the Office of Price Administration of the OPA? Anybody cool enough to remember the OPA? Aaron, you remember? No, you weren't.
And Galbraith ran it.
Huh?
And Galbraith ran it.
And Galbraith ran it.
You remember from history.
Wages
I was
and
there. I was on
prices,
staff.
put another way, prices and wages were controlled by a federal agency. Why? Because we were borrowing a hell of a lot and spending it on the war, and concern was inflation. We had rationing. You had the A sticker, the B sticker, or the C sticker. Anybody old enough to remember that here? Only a few of us. And we were on a wartime footing. And a lot of employers, especially in the defense industry, saw an opportunity to, in effect, enhance their employees' wages by providing them with health insurance. The OPA ruled that that was not a violation of the wage ceilings. And so you had a rather dramatic increase in the number of employees and their families in this country that were then getting health insurance, largely through Blue Cross Blue Shield organizations. Private insurance industry really had not yet gotten into healthcare in a big way. And so by the end of World War II, you had a substantial percentage, not a majority, of Americans who were in fact getting health insurance from their employers. Curiously enough, Franklin Roosevelt never proposed universal or near universal health insurance as part of the New Deal. He was urged to do so. The one woman in his cabinet was a very interesting woman named Frances Perkins. She strongly urged him to do it. He wouldn't do it. Why not? Here's FDR, Social Security, unemployment compensation, all these kinds of things. Why not? Universal health insurance. One Roosevelt had proposed it. Why not a second? Well, he had a very full plate, folks. And he was very concerned about taking on still another special interest. I mean, if you're interested, go to the library and take a look at the Wall Street Journal editorials on FDR during the New Deal. I mean, they are some reading, let me tell you. I mean, he was getting pounded, and there was a particular interest group that he would have had to go up against in a very bloody way, if you'll pardon the pun, if he had proposed some form of universal health insurance, and that interest group was the American Medical Association. My dad, Greek immigrant, became a doctor, practiced at 454 Huntington Avenue, right around the corner, now Burstein Hall, right across from the Museum of Fine Arts. I remember had those AMA pamphlets in his waiting room. This is after Truman proposed it, but you have no idea how tough the opposition of the AMA was. And so it was Harry Truman, beginning in 1945, who had the temerity to propose comprehensive and universal health insurance for the people of the United States. And if you know what his plan was, how was he going to do this? Well, today we call it universal Medicare. He proposed a modest increase in the Social Security tax. Remember, Social Security got into effect in the mid-30s. And by 1945, it was not only accepted, but very popular. We were familiar with it, and Truman, in effect, suggested that we expand the definition of Social Security to include universal and comprehensive health care for all Americans. Today, we call it a single-payer system. Nobody was talking about single-payer at that time. And every year that Harry Truman was president of the United States, he proposed major health insurance plans. Everybody thought he was going to be defeated, 48. Only Truman thought he could win it, and he did. You would think, after that victory, coming back in, the Congress would say, well, this is a mandate, no dice. Even though he had Democratic Congress, not in 46, but in 48. Why? Well, because the Democratic Party, for better or for worse, was not the Democratic Party today. And in point of fact, the Southern Democrats, who were white and racist, and very conservative, philosophically, strongly opposed this stuff. So in 45, and 46, and 47, and 48, 49, Truman proposed what we would call today universal health Medicare. No dice. I had an opportunity, Kitty and I were out at Wynne Jewell College, where I used to talk to the annual gathering of the Truman Fellows, and they asked if we wanted to go to the library, and so we did, and somebody said, is there anything you want to see? I said, yeah, I'd like to see Truman's stuff on healthcare. They brought out a big file, including his handwritten notes on speeches that he was making on healthcare, in which he strongly defended his plan, talked about his experience as a county judge, that's actually a county commissioner in Missouri, and the charity care they had to provide to people that had no health care, and what a profound effect it had had on them. It was interesting. He strongly defended the plan against the charges of socialized medicine and Bolshevik medicine, and the fact that this was the British National Health Service, which it wasn't. Said you're going to continue to have your choice of doctor, and nobody's going to tell you how to do that. This is simply a way of providing insurance for people. No dice. Finally, in 1950, he said, well, okay, how about doing it for people 65 and older? What we now call Medicare, right? No dice. AMA still opposed. Why? Because the AMA said, look, if the government gets into this, sooner or later that means government regulation of prices and fees. So despite Harry Truman's best efforts, nothing happened. Under Dwight Eisenhower, in his second term, there were a couple of baby steps in the direction of federally financed health care. The Kerr-Mills Act. Kerr was a wealthy, Democratic oil man, United States Senator from Oklahoma. And Mills was the House Chairman of Ways and Means. More on him in a second. Remember Fanny Fox, some of you? Came up here to see her at a burlesque theater on Lower Washington Street, in fact. And was caught bathing with her in the tidal basin in Washington at midnight. Bright guy, small town Arkansas, graduate of the Harvard Law School, better for worse, House Chairman of the Ways and Means Committee, and by no means a right winger. And so he and Kerr combined on the Kerr-Mills Act, which was Medicaid for poor elderly people. At that time, people were saying, hey, we're going to do something about these older folks. They're not insurable, it's not available, got to do something. But it was a means-tested Medicaid program, that's what we call it today, just for seniors. And then in the campaign of 1960, Jack Kennedy made Medicare, as we now know it, one of his major platform plans. Got elected, couldn't even get it on the floor of the House, folks, thanks to a fellow named Howard Smith, who was in his 90s, who was one of these very elderly Southern white congressmen, happened to be from Virginia. Wouldn't even approve it. As a matter of fact, there was a big fight over the Rules Committee because Smith insisted on blocking Medicare, and Tip O'Neill was the guy who engineered or tried to engineer a coup within the Rules Committee by expanding his membership and that kind of thing to try to do it. So the president decided to go to the Senate. Got a vote in the Senate, lost 48 to 52. Lost what? Health care for old folks. This has been a long-running battle. And it was only after the president was assassinated and Johnson took over and won that overwhelming victory against Goldwater that Lyndon Johnson began pushing as only Johnson could for Medicare. And Mills resisted. Now Johnson was a tough guy to resist. As any of you know, who've seen that famous picture of him leaning over Theodore Green, the elderly senator from Rhode Island, in his most persuasive mode. It's a great picture if you haven't seen it. And he was pushing and pushing and pushing Mills, and finally, in an interesting turn of events, Mills said, okay, I'll endorse your Medicare bill if you endorse what we now call Medicaid for poor people generally. Amazing, right? And in one fell swoop, we had Medicare and Medicaid supported by Johnson and Mills. That was in 1965. And that really is the beginning of the modern era of federal involvement in healthcare in a big way. Well, Richard Nixon was elected, 1968. And these days, I don't think Nixon would make it in the Republican primary. He was not for the Truman Bill, but he was for nearly universal health care. And so Nixon in 1971 proposed a bill which would, in effect, require all employers and employees to contribute to health care and health insurance at the workplace, without exception. No small business exception, none of that stuff. with an expanded Medicaid program to cover people who were temporarily out of work. That was the Nixon plan. 75-25, 75% employers, 25% employees, to cover the employees and their families with comprehensive coverage. Not 72 different products. One basic definition of comprehensive health care. Ted Kennedy and labor and the liberals opposed it. And if Ted Kennedy were alive and were here today, he'd tell you it was the greatest political mistake he ever made in his career. In retrospect, he said I should have joined with Nixon, sat down, put together a bill. The Nixon plan would have been a pretty good piece of legislation. But he resisted it. Didn't want the insurance companies involved. He wanted to stick with the Truman plan. And his congressional co-sponsor was a guy named Jim Corman in California. So if you read about the Kennedy-Corman bill, that's what they were for. They weren't getting in anywhere with their bill. They weren't working with Nixon. Finally, in early 1973, Kennedy decided they would better sit down with the administration, with the president, and go to work and see if we could come up with a bill. And the young assistant secretary of what we then called Health, Education, and Welfare, Stu Altman, who's been teaching at Brandeis for many years, just wrote a book about this, by the way, the story of what happened in the early 70s. Was the guy who not only worked on the bill, but drafted the message. And if you're interested, go online to the Nixon Library and get his message in 1971, in which he proposed this health plan, along with a number of other things, including HMOs. It's a pretty impressive message, folks. I mean, it's almost as good today as it was back then. Take a look at it. And so they were working together, put together a compromise version. It was moving along very rapidly, and then something called Watergate reared its head. That was the end of Nixon, and that was the end of the Nixon plan. And an opportunity to provide comprehensive health insurance for virtually all Americans went out the window. Nothing really happened from that time on until a fellow named William Jefferson Clinton was elected President of the United States, and Clinton came in with his plan, which was a very complicated version of the Nixon plan. The Nixon plan was actually quite simple. Now, there was one state that was really kind of fed up with the whole thing and said, the hell with it, we're going to adopt the Nixon plan on our own. And that state was? The state of Hawaii. 1975, the Prepaid Insurance Act in Hawaii was essentially the Nixon plan for Hawaii. It's been in effect ever since. Medicaid in Hawaii has been expanded to cover people who are temporarily unemployed. Essentially the Nixon proposal. It seems to work exceedingly well. Health costs in Hawaii, which is a very high cost state. You know, I taught out there after I left the governor's office. Kitty and I went out. Not a bad place to be covered. One of the reasons I went there was because I wanted to take a look at this healthcare system. Spent a lot of time. We did a series of 6 conferences around Honolulu, put together a task force of politicians, healthcare people, and so forth, and came up with a national version of the Hawaiian plan. It was in 1991. And I remember when I walked into a supermarket in Honolulu for the first time looking for generic cornflakes. That was in 1991. They wanted to charge me $4. I've said before that Kitty says I'm the cheapest guy in America. I think that's a little extreme, but not too extreme. And $4 for a box of generic cornflakes. I mean, prices in Hawaii are very high. Not healthcare. Some of the lowest health costs in America are in Hawaii. Now, Hawaii does not have a single payer system. It's a Nixon plan, but it has a limited number of insurers because it doesn't permit insurers to discriminate on the basis of pre-existing condition. And the 2 major insurers in Hawaii are Hawaiian Blue Cross Blue Shield and the Kaiser plan. They cover 90% of the people. And the dominant carrier is Blue Cross Blue Shield. So in effect, it's Blue Cross Blue Shield that not only provides a lot of the insurance coverage, but basically sets the prices. And while the docs occasionally make grouse about it, Hawaii Blue Cross Blue Shield traditionally has had a very consumer-minded board, made up of consumer advocates, employers, and others, unions, and so forth. And so the people in Hawaii have had, in effect, universal health insurance since 1975. And nobody in Washington, D.C. gives a damn. I keep saying to them, go over there in February. Well, you know, it's Hawaii. Dan Quayle, remember him? He was campaigning in 1992 for vice presidency with George H.W. Bush, and they made sure they kept him in very conservative areas. And he was in Orange County, Southern California. And he was going on and on about Clinton's plan being socialized medicine and all this kind of stuff. And some perfectly innocent guy said, what do you think of the Hawaiian plan? I think I'd done an op-ed piece in the LA Times or something about it. Nobody was writing about the Hawaiian plan. And Quayle said, well, I said, you know, Hawaii is unique. He said, Hawaii is an island. In fact, there's a lot of islands. And then he kind of went off. But in fairness to Dan Quayle, he didn't know any more or less than anybody else in Washington about Hawaii. Here's talk about a real-time experiment. It's been going on since 1975. 1.5 million people, not a bad pilot project, don't you think? And Hawaii has some of the best health outcomes in the country, some of the lowest costs. And it's not because people are looking at sunsets, sipping Mai Tais at 5 o'clock in the afternoon. Virtually everybody has health insurance. You go to an emergency room in a Honolulu hospital on a Saturday night, and there are very few people there. So now you haven't got all these uninsured people who are just jamming up the emergency room because they have no coverage. In any event, I, whatever it's worth, with the support of the Massachusetts legislature, came in with, in effect, with our version of Nixon, which was Hawaii with a couple of small changes. We exempted mom-and-pop stores, five employees or less, and we exempted startup companies for 2 years. Otherwise, it was basically the Nixon plan, or the Hawaiian plan. And we got it through the legislature. We made a mistake, folks, which was made again by the Congress administration in the case of the Affordable Care Act. We gave the thing 3 years to kind of be phased in. Some aspects of it went into effect right away. Students, if you're unhappy about the fact you've got to pay for insurance because your health insurance because you're a student, blame me because the student mandate was part of that. And people who were unemployed, laid off, ineligible for unemployment compensation under that bill got coverage right away. But we provided a 3-year period for the phase-in of the employer-employee mandate. I left office in January of 1991. A guy named Bill Well took over. Bright guy, funny guy. Was a young associate of mine at Hill and Barlow. I supervised the young associates. He used to say, well, where did I go wrong? I go wrong with you. But he never understood healthcare. And well did he said it was anti-business and so on and so forth. Nothing more anti-business than the system. And everything could have screwed up and he was successful. So, with the exception of those first steps, we never fully implemented the bill. And it wasn't, Mr. Speaker, until you and your colleagues got into this, with Mitt Romney, that we went back, but not to the Nixon plan, not to the Hawaiian plan, not to Dukakis' plan. This time, and Romney deserves credit for getting the ball rolling on this. The legislature basically took a look at a proposal from the Heritage Foundation, because that's where it came from. That's where it came from. And I hope most of you are reasonably familiar with the Massachusetts bill. I don't want to go into that great detail, but in point of fact, it was approved. In the closing phases of it, the governor was beginning to run for the presidency and started moving away from his own bill. And you remember the battle over whether or not non-insuring employers were required to contribute something, which finally was compromised out. Everybody thought, and then with 2 days to go, Governor Romney said, I'm not for it. He vetoed it. He was wildly overridden. Even Scott Brown voted. And so what we got, in effect, was the Heritage Foundation proposal. Also proposed, by the way, in December of 1992, after Clinton was elected, but before he took office, by 16 Republican senators, led by Senator John Chafee of Rhode Island, and including Bob Dole. That was their plan. Now, I think most objective observers will tell you that the Massachusetts plan is working well. In terms of access, we have virtually universal access. Virtually universal access, and we should be proud of that. And more recently, the legislature and the governor have combined now to attempt to deal with the cost problem. And they're going to be in the process of trying to make that work. And it was the Massachusetts bill, unquestionably, that was the model for the Affordable Care Act. Now, I'm not going into that in great detail. I want to highlight just a few parts of it, then I want to bring Wendy on. If you're interested, probably the best understandable summary of the Affordable Care Act is you'll find on the Kaiser Family Foundation website. Kaiser Family Foundation is probably the best, most understandable summary of the bill, so I commend it to you. But what does it provide? Briefly, these are just some of the highlights. It expands Medicaid to include all people up to 133% of poverty, whether they're parents or children or otherwise. It's a matter of right. Not an enormous jump. 22 states covered all of most of these people, as Wendy will probably tell you, even in advance of this expansion. But 22 states were covering them, the majority of states were not. Illegal immigrants are barred from coverage under the plan. More on that in a second. It requires all of the states to create exchanges, like the connector that we have, which in effect is a place where individuals and businesses can go to get insurance if they're having difficulty getting it in the private market. Directly out of the Massachusetts bill, no question about it. And if states refuse to create those exchanges, then the Department of Health and Human Services will do it for them. It increased doctors' fees for Medicaid, which traditionally have been quite low in many states, not this state, but many states, to match Medicare fees, which is a significant increase in many of those fees. It's standardized coverage. There are only 3 options in under the exchanges, and in addition, of course, it imposed a number of taxes on individuals who chose not to insure. That's the so-called individual mandate, which got a lot of people upset, which by the way, was advocated eloquently and correctly by Governor Romney at the time he was pushing it. And he was right. I mean, you can't cover everybody, including people with pre-existing conditions, if everybody isn't contributing, folks. And Romney said that over and over and over again to his credit. It increases the Medicare Part A payroll tax on upper income people. That's the first time we've done that, so as to pay for some of this. Imposes an excise tax on insurers with expensive plans, new taxes on big pharma, taxes on health insurers, taxes on medical instrumentation companies, taxes on indoor tanning. And the interesting thing about all of this is that those major interest groups, not the tanning salons, but the rest of them, accepted this. Not only accepted, agreed to significant cuts in reimbursement. That's the fight over this so-called cut in Medicare. They accepted these cuts. Why? Because they were getting 32 million new customers. Some demonstration grants on malpractice, a lot of stuff on wellness and prevention, expanded Medicare coverage, even with a cut in Medicare reimbursement, to begin to close the so-called donut hole, which was part of Part D coverage a few years earlier, and doubles the number of community health centers. And I want to say just a bit about this before closing this down and bringing Wendy up here. How many of you have been at a community health center? Not many. They're one of the most important features of the American healthcare system these days, in my judgment. One of them is just around the corner. In fact, there are tenants. But thanks to the stimulus program, the Whittier Community Health Center, which is what this health center is building a very impressive looking standalone building on Columbus Avenue, down on the left, across from the police department. Go over there and take a look at it.
It's open.
It is now open. Go over and walk in. I think you'll be impressed. And there were many, many community health centers around the country that got stimulus money and either built new ones or expanded them. There are about 20 million people today who get their health care from community health centers. And by the way, this is one aspect of the healthcare system that seems to have bipartisan support. Seems, because the Ryan budget does a number on it. But George Bush was a big fan of community health centers. Orrin Hatch is a big fan of community health centers. Bush wanted a community health center, at least one community health center in every county in America. within easy commuting distance of anybody. And they provide health care to anybody who walks in the door, undocumented or otherwise. And under the Affordable Care Act, funds were appropriated to double the number of community health centers there. So, as part of the plan, not 20 million, but 40 million Americans will be getting health care, presumably, from community health centers. And here again, a lot of Republicans, including Mitt Romney, have been strongly supportive of these, arguing that by providing access to virtually everybody, insured or otherwise, documented or otherwise, we would cut down dramatically on the number of people who are showing up in the emergency room for primary care. Which makes Romney's statement a couple of weeks ago a real puzzle to me, because he was quite articulate on the subject of why the new health plan that you guys had passed ought to cut down dramatically on the number of people who are showing up in emergency rooms with sore throats. And I don't know what happened to him. He said, well, they can always go to the emergency room. No, that's not a good idea, folks. Not what it costs 10 times the amount of money it costs to go see a doctor. So the expansion, the dramatic expansion of community health centers is very important, not often reported part of this, and may in fact turn out to be the public option, or at least a form of public option that is available. Now, to state the obvious, all of this depends on what happens on the first Tuesday in November. And it looks as if Romney is elected, that the act will be repealed. Or at least there will be strenuous efforts to repeal it, or to cripple it by simply not providing the appropriations that it requires in order to be implemented. So it's a big, big issue which hangs in the balance. If in fact the president's reelected, then I think we can be reasonably confident that we will go forward with this. And in many ways it's already in the process of being implemented. But the actual expansion of coverage to a lot of those folks that are not currently covered will not take place. Now, what's the Republican alternative? Well, it's a mix of things. They want to block grant Medicaid to the states. You may want to talk about that, Wendy, in your discussion. They offer some tax credits for really low income people that might help them to get health insurance. But you know, any of you know what it costs for a family policy these days in Massachusetts? I think we're at 16,000. Those tax subsidies wouldn't even come close to doing that. And a recent analysis by the Commonwealth Fund concluded that the Romney plan would result in some 75,000 uninsured people in the country. In other words, a 1/3 increase in the number of uninsured people. Now, one final thing, and that is this. Who are the uninsured in the United States? Well, we have about 50 million people without any health insurance of any kind. We have another 50 million who are badly underinsured. $10,000 deductible policies, very high copays, deductibles, that kind of thing. So you've got about 100,000 people either uninsured or seriously underinsured. 90% of those folks are working Americans with their families. They're not on public assistance, they're on public assistance to get Medicaid. These are working Americans and their families. No health insurance, very little health insurance. I think my party has done a terrible job of explaining this to American people. Nothing against doing something about pre-existing conditions, nothing against keeping kids on the policy until 26, but the fundamental fact of the matter is that this, in my judgment, is all about whether working Americans and their families are going to have decent, affordable health care. And if we went out and took a poll tomorrow and asked the American people, should working Americans and their families have decent, affordable health care, what do you think the numbers would look like? 93% say yes. And you know, the White House and the Congressional Democrats have been saying that. May come as news to you. And if there's one lesson that one learns, sometimes painfully, and I've learned it many, many times, folks, you gotta have a message. I don't think pre-existing conditions is the message. I think working hard to make sure that all working Americans and their families have decent, affordable health care is a message. And in my view, the Democratic Party has done a very good job of explaining it. Without further ado, Professor Wendy Fernandez.